Can wearable devices tell you something about the health of your heart?
Yes. If one develops a irregular heart rhythm, which can give an increased risk of stroke, all the wearables will alert people, and that can prevent serious disease and really catastrophic problems.
Professor Malcolm Findlay is a board-certified cardiologist and professor of cardiovascular medicine and devices. He's published a long list of scientific papers, cited almost 5,000 times. Malcolm's also a pioneer of innovative treatments for heart disease and has more than 15 years of experience treating heart rhythm problems.
I make diagnoses based on these wearable devices, and one of the many things that you might use to guide you is heart rate variability.
Am I healthiest if there is no variability in my heart rate?
It's the other way around. The general idea of being healthy would be someone with both control inputs into their heart, both the fight and flight response, but also the relaxation drive. For example, patients who are under severe mental stress, the fight or flight response will be slightly elevated, and that heart rate variability tends to decrease.
What are those other things to do with the heart that you can measure?
ECG is one of my favorite things in the world. This is the direct measurement of the electrical activity of the heart. It has really changed the world when we're looking at diagnosing super slow heart rhythms, for example, and determining whether they need direct treatments.
There's a very big range of measurements and feedback on these devices. If you want to live longer, what are those other things that you can focus on? Malcolm, thank you so much for joining me today.
Thank you so much. Thanks for having me.
It's a pleasure. Now, we have a tradition here at Zoe where we always start with a quick fire round of questions from our listeners. And you can answer with a yes or a no, or if you have to, a one-sentence answer.
Okay.
Can HRV tell you something about the health of your heart?
Yes.
Can wearable health tech help you look after your heart?
I think so.
Could focusing on the wrong numbers put your heart at risk?
I think if you focus on the wrong numbers, you can do the wrong things and get the wrong idea. So I guess yes.
Can two people with the same heart rate have completely different HRVs?
Oh, yeah, absolutely.
If you want to live longer, is HRV the number to focus on?
If you want to live longer, there are lots of things to focus on, and HRV is just one of the many things that you might use to guide you. But actually, I think there are more sensible things you could use to guide you rather than focusing on HRV.
And what's the most common myth that you hear about heart health?
Okay, so the most common myth is that one thing, for example, concentrating on doing exercise, can negate concentrating on some really important medical issues such as high cholesterol. And so just looking after yourself in a general way doesn't negate the need for some proper medical intervention.
Well, I'm excited to get into all of that, Malcolm. And actually, for today's show, I woke up this morning, I thought I'm going to actually wear two different types of watch, both of which tell my heart rate. So I thought it'd be quite fun to do that as we go through this. And they also tell me my heart rate variability, this HRV thing that you mentioned, which I know is hugely popular at the moment. What is HRV?
Yeah. Heart rate variability is something you can measure from the heart rate. It's like the technical side of things is it measures the subtle changes in the beat-to-beat time differences of each heartbeat. When we talk about it on heart rate variability with watches and so on, it's not really the big changes that the heart rate will change with doing exercise or when you get excited about something or going to sleep at night. It's more like the subtle wobbles in the heart rate from beat to beat and looking at the course of that over several minutes or even over the whole day. So the measure's quite a mathematically complex measure that was first brought out in the 1970s, I think, as a way of guiding medical treatment and risk prediction. I think in hardcore medicine, it didn't fulfill its promise in that people were trying to look for heart rate variability as a good predictor for future disease or future problems. But actually, it's kind of a weak one compared to some other very serious medical testing that we have, for example, CT scans or MRI scans. But as a wearable device, I think wearables have picked up on this measure because you can take that and it gives another insight about your overall physical general health and general health metrics.
Am I healthiest if there is no variability in my heart rate and it's completely
No, it's
steady?
the other way around. Absolutely the other way around. So the general idea of being healthy would be someone who have both control inputs into their heart, both the sort of fight and flight response, the sympathetic, that's the adrenaline sort of drive, but also the relaxation drive, the parasympathetic, that works against that. And having both inputs from the nervous system to the heart subtly changes how that beat-to-beat variability happens in the heart, and that is the HRV. And so the HRV being higher, as measured by a watch, really indicates that you've got those inputs really strongly affecting the heart. Let's take an extreme example. People with a heart transplant, you measure their HRV, it's completely flat. Why is it completely flat?
So does that mean it's zero?
It's almost zero.
Okay.
And that's because they've had the nerves to their new heart essentially severed. And over time, there have been cases where people have developed a heart rate variability back in their new transplanted heart, probably because they've regrown some nerve innervation to their heart. So in an extreme scenario where you remove those nervous inputs, you get almost zero heart rate variability.
And so if zero is sort of bad, you would expect variability. Does everyone have basically the same level of this heart rate variability?
Is everyone the same? The answer is no. Like any human parameter, things vary a great deal. So a sort of average number would be around 50, but it can be anywhere from the low 30s to the high 70s on the typical wearables. And that absolute number doesn't really give you a huge indication on that person's health. And I think that's something we can talk about, is how HRV, the exact number, doesn't help us a great deal, but the changes can really monitor whether or not someone's leading a more healthy lifestyle. The other thing, just to mention, heart rate variability goes down as you get older, pretty high in the teens, and then it's a downward trajectory ever after that.
Well, I'm already fascinated that what's normal is for it not to be steady, because I think in my mind's eye, you just want your heart beating regularly.
The measures you're getting are measured in milliseconds, like that 50 number is a time variable. So let's not think that the heart is jumping around all over the place. That can be a sign of there being a actual medical problem with the heart rather than it being a measure of health. And I think that in patients with an irregular heartbeat, atrial fibrillation, which is one of the things I see many of my patients with, heart rate variability actually is not a valid measure, because in that case, the control systems of the heart have been overrun by abnormal heart rhythms. It's really a measure that's useful only in people who have the normal heart rate, the sinus rate.
I think what you're saying is for a normal healthy person who's measuring their heart rate variability, actually their heart rate is very steady and there's this like very subtle changes going up and down.
Exactly right.
And you then said, however, if I'm seeing a bigger change, you mentioned this word atrial fibrillation, I should be worried. Could you talk about that for a minute?
Yeah, sure. So just to sort of back up, atrial fibrillation is a specific type of heart rhythm abnormality. It's the most common. About a fifth of all people will experience it sometime in their life. And actually it can be pretty serious, particularly if it's there the whole time. Not only is it serious, but it can be treatable. And all the wearables will alert people if they have possible atrial fibrillation or if it's detected atrial fibrillation. And basically that's been a huge driver for the uptake of the ECG in wearable devices. Now, in that arrhythmia, the top chamber of the heart, rather than being triggered by the sinus node, which is the heart's own pacemaker, there's a electrical chaos going on in the top chamber of the heart, which completely overwhelms any control mechanism for the heart rate from that sinus node. And so the ending heart rate is completely irregular, and it's completely driven by these chaotic activities in the top chamber of the heart. And I think until someone like me who puts it right and gets back into the normal rhythm, heart rate variability doesn't really come into play in the way we're talking about it today. It's a disease and it really needs specialist input.
If I come back to the HRV, you mentioned that there's these different signals that are driving what's going on. Could you help me to understand a bit more, like what's controlling it and what's happening and why?
The one we're familiar with is the way the heart rate increases when we do exercise, right? So that would be the fight and flight response. I mentioned that earlier, the sympathetic activity driving an increase in heart rate. But tugging against that is this idea that you have the nervous system that helps the body relax. So when one sleeps, that really pulls down the heart rate. And It used to be thought that either you were on one, either the sympathetic or the parasympathetic system were active. And, if you're doing exercise, it would be sympathetic. And if you're relaxing, parasympathetic. But actually, in truth, both are working at the same time, all the time, to slightly lower the heart rate or slightly increase the heart rate. And the exact ways they're working on the cells in the heart vary very slightly. And so the cells will be kind of the timing of those pacemaker cells will wobble from beat to beat. It won't be a precise clockwork. And that's the wobble that we're measuring in HRV.
A bit like putting my foot
An
on the
accelerator
accelerator.
and a brake. But actually, in a car, you'd fail the driving test if you're driving the accelerator and brake at the same time. The human body, and actually many complex control systems, have both an accelerator and a brake operating at the same time.
At Zoe, we know small changes can create big results. Subscribing to this channel is one such change. It helps us reach more people and lets us bring you more of the latest science on health and nutrition. So if this video has given you something useful, subscribing is the easiest way for you to give us a little back. I work out regularly because I'm told it's really good for my health. And since I started to have these watches, I actually notice my heart rate now and sort of see how it changes. And one of the things that I've been most struck by is that my heart rate changes fast. It goes up fast, but also sort of comes down fast, which I was quite surprised by. I sort of always assumed it was quite a slow and steady change, but it seems like it can change in like a matter of like
if you're going to be chased by a saber-toothed tiger, you don't want to be waiting 5 minutes for your heart rate to get up before you can run away. So these are deep biological mechanisms which have a huge survival advantage. So if you need to do exercise, your heart rate needs to be able to go up straight away.
And so when you talk about nervous system, like, does that mean that there's like sort of signals from my brain going straight through nerves, or?
The whole body's connected, right?
Okay.
So the brain, what we think with, is connected to the spinal cord, which also supplies the hormone organs, which will give out hormones for daily function. And I think we're getting more and more used to the idea that every organ is connected to the brain, and every organ has an influence on every other organ in the body. I mean, we're one body. And now the heart, when maybe I was in medical school, the overall thinking was this was a pump and it would just dial up and dial down. But actually, there's this huge number of nerves innervating the heart. These are not directly from your thinking centers, but the thinking centers, the brain, do then pass signals down to influence the nerves actually supplying those heart muscles. And actually, in my PhD, where several years ago, we were doing some experiments measuring the exact electrical activity in people's hearts whilst we were doing just thinking problems, active relaxation, or even something called anger recall. So we got people to imagine they were in a very stressful situation, and then I'd act the sort of fool to get them very angry. But at the end of that, we were discovering that just having these thinking tasks, psychometric tasks, can directly affect the way the heart cells activate and relax, and the timings of which. The thing I was particularly interested in there was how that could predispose to abnormal heart rhythms. I guess the key learning factor is that the influence of the brain to the heart is extremely deep. So we have these influences which are not just, the heart being a pump, but the whole body connects. So when you are even just thinking about doing exercise, the heart will start to adapt to get ready to do that exercise.
So sort of warming up.
Exactly right.
So if I understand it right, you're saying there's this sympathetic nervous system, which is the fight or flight. That's going to push my sort of heart rate up.
Absolutely, yep.
And I've got this opposing system, the parasympathetic nervous system, which is sort of trying to get me to relax and is pushing it down. And these are both on all the time.
Yep.
And you're saying they're very subtly changing, maybe even by what I'm thinking that maybe there might be a saber-toothed tiger, or I'm thinking maybe I'm a bit tired, or whatever those things are. And that's sort of adjusting my heart rate all the time. Are you saying that there's both direct nerves, but also there's these hormones that we always hear about?
Exactly right. So the adrenaline hormone can be measured in the blood, but almost more important is the direct nerve innervation to the heart's own pacemaker cells.
And so I've got sort of both those things going on?
Exactly.
So it's not just the nerves, there are hormones as well.
Yeah, so those nerves actually supply the glands that then secrete the hormones. So these things work as a single system.
Can I change my heart rate without the hormones? Like, is there also a direct link, or is it?
Yeah, no, there's a direct link.
And this is why it can be so fast?
Exactly right. So actually, in some medical testing we'll do on people's heart rates, we can stimulate nerves, which will increase and decrease people's heart rate. So we actually directly stimulate the tiny nerves supplying parts of the heart, which then we see the differences in their heart rate.
That's fascinating. So you can literally adjust people's nerves to try and get these things back into...
Yeah, that's something we do to sort of work out where the best areas are to do treatments. But, there are potentially future treatments sort of to come from that as well.
So could we talk a bit about, in today's world, what is influencing sort of my HRV? Because I'm probably not going to see a saber-toothed tiger. What are the different factors that are likely to be influencing the HRV that, I might end up measured with one of these devices?
Yeah, so HRV, as we're seeing on our wearables, give a snapshot of how these nervous drives are affecting the heart. This measure can vary quite a great amount between different people, but for ourselves, day to day, it should be fairly similar. In many instances, the trends in that will be an indicator of one's overall sort of health status. So, for example, if you have people who become unwell, get an infection, you would expect to see the heart rate variability decrease as the body is spending more time fighting in the infection. The sympathetic system, so that's the fight or flight response, will be slightly elevated, and that heart rate variability tends to decrease. Likewise, in people, the same thing's been seen in people who've had a heart attack, heart failure, or who have quite severe diabetes. On the flip side, if people are, let's say, changing their lifestyles, improving what they do on a daily basis, getting a good night's sleep, for example, then we end up finding the heart rate variability will follow those trends, and you'd expect to see an increase in heart rate variability. So that number would generally increase over time.
Now, you've mentioned a little bit sort of psychological stress, and I know you've actually done some research into the connection between sort of the heart and the brain. Can you tell me a bit more about how, as opposed to like maybe an infection, how does stress play into this? Does it increase my HRV?
Yeah, so stress, again, would drive that fight or flight response in the way we generally think about mental stress. And so we'd expect things to decrease the HRV. Now, to be honest, the hardcore research into these things is not super well done, but there's a wealth of evidence from patients with, for example, severe psychiatric disorders, clinical depression, as well as patients with severe autism, showing when people are in their worst states, their HRV is decreased. I've got to say, these researchers tend to be from before the wearable era. So these are patients being measured with heart monitors over 24 hours and so on. But I think the data's a good one, that we know that patients who are under severe mental stress will decrease their heart rate variability. It's not really that useful clinically to change treatments. It's really a follow-on. It's like an output measure. So if you've got someone who's needing mental health support, you may find as things get better and things improve, their heart rate variability increases. But it's not great at telling us, oh, this person's heart rate variability is really low, they need mental health support, or they need this doing to them. What you do to improve things, let's say, tends to come before the heart rate variability becomes useful.
Before we move on, I'm conscious that both these watches, in fact, measure a lot of other things to do with the heart beyond HRV. And I think we touched on them briefly. So heart rate is one that I definitely see.
Yep.
One of them says it can do an ECG, which is another thing I'm a bit unclear about what it is, except I've seen it on all those dramas on TV. What are those other things to do with the heart that you can get out of these devices?
Okay, let me just say the ECG is one of my favorite things in the world, right? So this is the direct measurement of the electrical activity of the heart. It's kind of incredible that just this tiny watch can give the real direct indication of those little electrical impulses within the heart, and that can be translated onto the screen on the watch or whichever other wearables are available. These quality of the ECG are really clinical quality. I make diagnoses based on the ECGs that I see from these wearable devices, and they are accurate devices.
You would make an actual diagnosis based on the ECG that could come out of my Apple Watch?
Absolutely right.
That's amazing.
That is a direct measure of the heart's electrical activity. Every so often we have to be careful, but the majority of the time, I can make a really good diagnosis from the ECG from a wearable technology. And that has really changed the world when we're looking at diagnosing irregular heart rhythms, diagnosing people with super slow heart rhythms, for example, and determining whether people need direct treatments.
For those of us like me who still don't really understand what an ECG is, could you explain for a minute what it is?
Yeah. So the ECG stands for electrocardiogram. And this is the direct electrical measure. It's a tracing of the electrical activity of the heart. And typically, in the very first ones performed, it was between the left arm and the right arm in buckets of salt water connected to a mercury galvanometer, which flickered as the electrical balance changed between the two arms, indicating the electrical transmission of the impulses through the heart. And that has gone from being these enormous contraptions, which you can see in the Science Museum London, if you're interested, to being something that you can get for less than 100 quid to wear on your wrist. And the neat thing is that tracing is not just an interpreted number, that's the actual recording of those electrical flickers of the heart. And so knowing these and knowing the kind of normal timings between people, it becomes quite straightforward in one sense to then work out exactly what's going on underlying in the patient or in the person who's having their ECG measured.
What's the value of that? How does that tell me something about my health that's important?
Yeah, if we just rewind 10 years ago, if somebody came to me and said, I feel like my heart goes irregular from time to time, we could say, okay, let's do a tracing of the heart in the office. We'll do an ECG on the machine, and actually they're not having arrhythmia at that moment. So they're not having the symptoms. But to get the diagnosis, we really need what's the term is symptom arrhythmia correlation. So we have to do the tracing when people are feeling the symptoms. And if you're wearing it the whole time on your wrist, you can now do that. Anyone with a wearable can do that. And that means that if one develops a abnormal irregular heart rhythm, which, for example, atrial fibrillation, as we mentioned earlier, that can give an increased risk of stroke if it's not treated correctly. So now the watch can detect atrial fibrillation. People go to their GP. I had these funny feelings. My watch says I have atrial fibrillation. GP can give a very simple blood thinner, which really removes that risk of stroke. Not completely, but almost completely. People have different risk factors. So not everyone with atrial fibrillation is at risk of stroke, but certainly people over the age of 65 who develop atrial fibrillation, well, that's really high on the radar. Or people with other health problems, that becomes a major risk. And so these wearables are not just something which is useful for people on a day-to-day basis to monitor their health and improve their day-to-day health status, but can also prevent serious disease and really catastrophic problems.
Now, it also measures my heart rate, which is different from the heart rate variability, right?
Absolutely right. Yeah. So the heart rate is how fast the heart is going, and we expect that to increase with exercise and decrease with rest. And that's something which does have important health status implications, right? So if your heart rate drops low at night, well, that's a good thing. That's implying that you're sleeping very well, that you're having good rest, for example. Likewise, if people are increasing their heart rate significantly during exercise, that's a measure that they're pushing their body. They will be getting benefit from the exercise they're doing. So these things are important, but they're measuring something different from HRV. One has to be kind of careful that big changes, sudden changes, may imply an artifact rather than being a true measure of one's heart health. A great example of that is if people measure an HRV on a day-to-day basis and it's always running about, let's say, just 55, and then one day they're particularly stressed and they measure it down at 20, well, that's far more likely just to be that because you're stressed, you haven't attached your watch properly than a single measure being a measure of the change in your health status. It's really the consistent, longer term, subtle changes which are a more direct implication of one's health status.
Within those constraints, would you view these devices as basically quite accurate for these other measures, or are they like a long way behind sort of what you might use when somebody came in to you in the clinic?
I think they fill this beautiful gap between guesswork and clinical examination and measuring your own pulse in the neck and so on when we're doing exercise. They fill this gap between that and essentially pretty hardcore medical investigations, which are time-consuming, expensive. Wouldn't it be better if we had a way that people could just have that measurement straight away? And these wearables fill that gap. So I'm a huge fan of the wearables and a huge fan of people, using that to take control of their own wellness and their own health.
Now, you can spend a lot of money on these devices, and there's a very big range of how much they cost between like sort of the cheapest to the most expensive.
The key thing is one which measures the ECG, I think is important. The ones which just do a pulse rate, well, that has its own use, the older Fitbits and so on, but they're not able to go to that next level of actually making that firm diagnosis. I actually don't think there's that big a difference between ones which are £1,000 and ones which are £40. In fact, just an experiment, I went on to a website that I didn't recognize and bought the cheapest one that I could find. And, other than the instructions being hard to understand and the user interface being pretty crummy, the actual results it gave me, the actual ECG trace that I was able to get from this, $40 piece of plastic were actually pretty good. So they would be fine in the clinic. So you don't have to spend big bucks to get something which will do the job.
Do you want to know the most powerful thing that Zoe taught me? Gut health is health. A healthy gut can unlock better sleep, more energy, and it's key to living more healthy years. We're living through a gut health revolution, and Zoe is leading the way. We've used the data from 300,000 gut health tests to create a brand new app and a brand new gut health test. Our app is based on the world's largest microbiome DNA database, developed here at Zoe. And our new app gives you personalized health insights from day one, and then helps you build healthy eating habits that actually stick. Our proprietary AI allows you to snap a photo of a meal and discover immediately exactly what's in it and how it's going to affect your body. It can even identify which processed foods in your fridge might be a high risk for your health and which might be fine. Because the truth is, our current food system is broken, flooded with misinformation, dominated by big food companies that care about their profits and not about your health. You deserve better than this. And with Zoe, you can learn to make smarter food choices and feel healthier in weeks. So how do we know this? Well, we tested Zoe in a randomized control trial that was published in Nature Medicine last year. And compared to a control group, we showed that the people who followed the advice from Zoe's app significantly improved on a whole range of health measures. Add our brand new gut health test, and you can discover how gut clusters work as an ecosystem in your gut to support important functions like healthy fat distribution, your heart health, your blood sugar control. Last year, after just 10 days of antibiotics, my gut was reduced to only 6 of the 50 good bugs. Now, with Zoe's advice, I have 23. And I'm working on improving that every day, every week, month, and year. Because after 8 years and 300,000 microbiome tests, Zoe knows gut health. Are you ready to join the gut health revolution?
Final question before we move on to what's the actionable advice to people? Is there any science about the relationship between the food that we eat and these sorts of measures like HRV and the rest?
Yeah, so there is one key factor, which is alcohol consumption's really been shown to be adverse on so many health metrics. Low levels of alcohol consumption, people who claim vociferously that that's going to be bad for you. I'm not sure how solid that is. I think low levels, the social benefits are pretty huge. The social benefits for small amounts of alcohol consumption. But when one gets over, and I think the UK government sort of recommendation of 1.5 glasses of wine a day at the upper end, that's probably quite a good average for people to aim at, where one can be confident that's not going to adversely affect one's health profile. So alcohol's number one. I think once we go beyond alcohol, one is really getting into the sort of secondary level effects of food. So if one has a classically unhealthy diet, that will have a whole heap of adverse health outcomes, I guess. which is likely then to be reflected in the heart rate variability. But I don't think that it's fair to say that if you're just having a burger and chips, that directly affects the way the heart rate controls.
Because if you had this over a long period of time.
I think this is, exactly right. This is the long-term habits, the long-term way people, live their lives, which has those effects.
And Malcolm, if I was to change my diet and really improve it, does that mean that over time I might actually see this HRV measure go up?
The answer is yes. Like if you change your diet and particularly changing one's lifestyle, I think diet goes along it's not just the food on the plate. It associates with a whole bunch of other health activities. I think the food is going to be a huge part of that, but I kind of suspect that's going to be reflected in the whole change in one's wellness and one's gut health and so on as well, rather than it being just food directly affecting the heart rate variability. Improve your diet, improve your lifestyle, you're less likely then to have to come and see me in a professional capacity.
So I think having sort of helped us to understand what these measures are, I'd love to start to talk a bit about actionable advice. Yes. You've talked about the pros and cons of some of these different measurements. And I think, my takeaway from HRV is that it might be a great measure of sort of an output of my health, but it's not necessarily something that sounds like I can change on a day-to-day basis. So maybe we could start with this question about like the metrics that we should be tracking. And maybe let's start with HRV. How should I be thinking about that?
Yeah, so first of all, I think HRV is a useful measure. It's got some scientific basis and it can give an indication of one's health status, particularly the changes in an individual. So if I measure and compare myself to myself yesterday, my numbers last week, then I get an idea. It's no good me comparing mine to yours because our baseline starting point may be different.
Malcolm, I was literally going to ask that because you mentioned 55 and mine, having seen this over the last couple of months, is about 33. So now I'm really worried that I'm really unhealthy.
Really, don't be worried.
Okay.
That's your own number and the changes in one's own number that are going to be the key things to track on an individual basis.
How far does it need to change to care? Because that's the other thing I notice is mine fluctuates around a very little bit. So like if it goes from 37 to 33, is that a real difference?
As a one-off, that's probably not a real change. Let's say things are changing in a negative way. You'll probably be noticing other things having changed and be able to pinpoint, actually, I've been in bed for the last 2 weeks with a flu, or I've had a minor operation, or it's been a particularly stressful part of my life. And that HRV will kind of be a reflection of those other things happening. It's pretty rare. In fact, I find it hard to think of times where people have spotted an HRV change and only the HRV change has preceded us being able to say there's something else that needs doing. Those measurements tend to be something that follow feeling unwell or something else changing. I think it's a little different if one's looking at it from a wellness point of view, whereby you may want to say, okay, actually, I've made a change in my life. Is this actually having an effect on my overall body's wellness? It's something to give themselves a second encouragement as a nice feedback to say, okay, I'm on the right path here. But, it will get to a level and it will fluctuate around that level. I think it's never going to just keep on increasing up to 50, 60, 100. So it might fluctuate between the low 30s up to the low 40s and keep fluctuating. If that's where you are, that's fine for you. I think those are quite big variations, but it's a long-term shift from say you're in the low 30s, low 40s, then you shift to the mid 30s to the mid 40s. Weeks are the time frames where one can really be sure that any measurement is consistently changing. Most of the time when people have come to me specifically asking about HRV, it's been pretty easy to pinpoint, hold on a sec, you've just changed your job. Now you're having to get up at 6 a.m., but you're still going to bed at midnight, whereas before you were getting up at 8. And these things can make a big impact and people have to accept impacts of change in their life and adjust things accordingly to fulfill their health status.
All right, well, I think we talked a lot about HRV. I'd love to talk about some of these other things. And I'd love to come back to your favorite thing in the world, ECG,
Yeah.
because you said that's amazing. I'm 50. As far as I know, my heart is fine. How often should I run this ECG? What am I looking for?
The ECG on the wearables, it's a great add-on. Okay, so most people, most of the time, won't need an ECG. Their hearts, your heart's amazing. It's so reliable. So an occasional ECG measured on if your watch has that functionality, take an ECG from time to time. That's going to be fine. It's kind of a fun thing to do. If people have symptoms of palpitations, or they notice their heart skipping, or they've had a definite symptom of, hold on, I'm actually feeling way more tired, or something's changed, then it really gives a great hardcore indicator of what can be happening with their heart rhythm when they're experiencing those symptoms. And one of the neat things about the watches, of course, is you're wearing it the whole time. It will detect if the heart rhythm becomes abnormal just from the pulse function on the watch. And if that detects something which is abnormal, that can prompt you to then do the more advanced measure, the ECG, just there and then, without having to come visit the doctor, without having to go through your family doctor. Or
So one of the things I'm wearing is an Apple Watch, and you're saying that might actually just notice that my heart rate is all over the place, and it might actually trigger something?
you can see a prompt irregular rhythm detected, and then you can get a proper ECG performed from that same device. I think it's pretty amazing.
I think that's extraordinary. Could we speak about heart rate now? Because we had Peter Atrial on the podcast quite a long time ago, and he spent much of the podcast talking about this idea of training at different levels of heart rate, these zones that you were talking about. How much value is there in looking at the heart rate? How much should I care that in my life I'm trying to get my heart rate up to a sort of certain levels during the day or during exercise? What's your...
So it can be useful, really, really useful to guide training and training fitness when people are trying to go for their athletic targets, when people are getting their fitness targets. I think it falls down a little bit if we use the same idea, well, that's necessary to make the healthiest you possible, right? So the key benefits probably come from doing not the extreme exercise, not extreme training. It's going to be getting outside of the resting zone, right? So when you start to significantly increase the heart rate, it's not just the heart that's benefiting, but the whole body, the whole blood vessels, the muscles, the strength, the bones, everything about the body, longevity improves with exercise.
When you talk about getting your heart rate up, how do I think about what that means? So let's say I now have this device that says to me, when I'm resting, my heart rate is 60 or something.
60 or 70, yeah.
What does that mean when you're saying you want to get your heart rate up?
A standard, most people will find they're doing some brisk exercise, you'll get into the realms of getting heart rates above 110, 120. That is definitely changing from a normal resting type activity to a formal exercise kind of zone.
And in terms of heart health, are you saying that it's sort of getting to that level is the thing that you are most telling your patients they want to do, rather than trying to get it to 150 or 160 for some short period of time?
Yeah, I think that when you're getting to 150, 160, that is really starting to be exercise training. I'm not convinced that we've got great data that improves the cardiac health more than a more subtle exercise. So if people are starting to go on an exercise program and they're finding it hard to stress themselves and they're saying, well, I'm not getting heart rates of 160, 170, don't feel disappointed by that. If you're managing to boost your heart rate above 110, 120 beats a minute, that's doing good. That's going the right way for people's health.
How much time in the week should I be trying to get my heart rate above that 110, 120?
Yeah. So different people have different lives and things are tricky, right? I think it's clear that the more time, the better, within reason. The standard sort of bit of advice would be, see if you can do about half an hour a day. I think that's probably too much. I think there's good evidence that even if you're doing half an hour a week or 2 hours a week, for example, to half an hour every couple of days, that is going to be hugely beneficial compared to not doing anything. So more is better, But the most important thing is to be doing some. And once you're doing some, you'll notice the benefits remarkably quickly and being able to keep that as part of your schedule.
What about sleep consistency? So I've noticed that actually on both these devices that are on my wrist. And as I understand, it's sort of the measure of how much the time you go to bed or wake up varies. So it's not just how many hours you sleep for, but, I'm guilty of this. Like maybe during the week, I might go to bed at one time, and then maybe at the weekend, I'm going to bed, 3 hours later. Does this matter?
Yeah, the body's own day and night cycle rhythms don't really change on a individual day basis. And that's why you get these jet lags. If you're traveling a huge amount, you will be going to sleep at hugely different times. And that's really disruptive for not just the time you sleep, but the quality of sleep. And you can end up having the direct feeling of jet lag. Now, the kind of interesting thing is that quality of sleep does relate to the heart rate variability. So getting good quality sleep is like the input, and the heart rate variability is like the output. So if you improve your sleep consistency, you'd hope and probably even expect to see your heart rate variability increase as you spend longer in these restful periods and have the benefits from that.
Is sleep consistency just getting 8 hours sleep, or is it more than that?
Although this may be, again, hugely varying between individuals, 8 hours is not going to be the right thing for everyone. Many people will feel great on 6.5 hours sleep, but it's really making time so one isn't chiseling away at sleep at both ends, and one isn't having things which will stop one getting a deep night's sleep, getting enough REM sleep, for example.
And finally, VO2 max.
Yeah.
What is it, and does it matter?
Okay, so VO2 max is a measure of the real exercise capacity of the body. It's a great metric, right? It's a great metric for athletes and for training, and has been useful in certain amounts of clinical health and clinical studies. It's been a useful research measure, hard to actually pin things on. And what one gets from the watches and what one gets from the wearable world, the importance of VO2 max outside of being a measure of exercise training is a bit indeterminate. I think it can be super important in the clinical environment, but even in the clinical world, I think it's been only in the last 5 to 10 years, this is really coming into the fore as a useful thing that we can make actionable decisions on. As far as the accuracy and the usefulness on the wearables, I think the jury's still out on that, other than as a measure of real exercise training. So if one's using that as a training metric, great. I mean, there's a science behind it. But if one's using that as a, like, how's my general health doing metric, I'm not so sure how we can interpret that at the moment.
Final question. Should I be comparing myself against others with these metrics, or is this only about like my own variation?
I mean, one of the most important bits of advice I've ever been given was, don't care what other people think, right? I guess this is about you, right? This is about making oneself better, playing the cards you've already got, right? You're not going to be the same as your mate in the cafe or the pub. Things will be different. So these health metrics shouldn't be a competition between you and the person next door. This is about you making yourself better for your own health and your own longevity and your own feeling of well-being.
Brilliant. Malcolm, I would love to do a little summary of what we've covered. So the thing that springs first to my mind is this thing where you said ECG, my favorite medical thing in the world. These little devices on my wrist can actually measure the electrical impulses in my heart. And you're saying that if there is a problem, these are actually like sufficiently accurate that you could use them for your own diagnoses.
Absolutely.
And that you do so. And so that's amazing. Now, if you don't have anything wrong with your heart, you shouldn't stress too much, but you can do it. But if you are having palpitations or anything like this, actually, you can do this ECG and it could really capture that there's a real problem. And then you can go and see a cardiologist and they can actually really fix something which otherwise, could end up like being a life or death situation.
You can imagine that brings that whole treatment forward by even months. People now can go to the doctor with a tracing which gives the diagnosis, and then we can institute treatment straight away.
We talked a lot about heart rate variability, HRV, and my understanding from this is like you think that is a useful measure of understanding the state of my health, and it's something that's sort of like an output of the activities that I'm doing, like to improve my health, but also things that might be making me less healthy, like stress and having a virus. Would actually be monitoring that more over weeks than on a sort of day-to-day basis. And that the changes are going to be quite subtle. So I took away, like, I'm at 33. If that changes to 38, that's actually quite a big shift. It's not going to suddenly change to
if that's consistent,
to
that is going to be something which is useful and worth measuring.
And the reason why it's interesting is because actually all the time my heart has been pulled in these two different directions. I've got this, I wrote this down, sympathetic nervous system, which is like fight or flight. So it's like pushing up my heart rate so I can run away from the saber-toothed tiger. But on the other hand, I've got this relaxing system. You said the parasympathetic nervous system that's sort of calming me down. And so the HRV is interesting because literally from one beat to another of my heart, these things are changing, and you want to have sort of somehow this responsiveness is a sign of like being healthy.
Exactly right. So that little wobble in the heart rate, we're coming back to where we started, when we started talking, the subtle wobbles in the heart rate, which HRV measures, gives this insight to the whole body and whole heart health.
And nutrition definitely matters long term. Short term, you said alcohol can have a sort of direct impact on this heart rate variability, but you were not saying you could never have a glass of wine. You were saying something like, don't have more than a glass of wine a day. That was sort of my takeaway. We talked about heart rate, which I thought was really interesting, where you were saying, if you're literally doing exercise training and trying to optimize that, then some of these like different levels of heart rate can be valuable. But actually, for most people thinking about maximizing their longevity and healthy years, the key is to get your heart rate sort of out of this resting zone. And you said that's probably like 110, 120. You want to get to that sort of number. And even if you're doing that for 2 hours across a week, that's going to be hugely beneficial.
Yeah, absolutely right.
And then maybe finally, I took away, there are other measures that you think are interesting. Sleep consistency is really important. And it's the sort of thing that's going to drive your HRV. You're saying, like, if I can get that sleep consistency, it's supporting my health, I'm going to see it. And then although steps is like this old metric, actually, if you can hit 10,000 steps a day, this is going to do something really good for your health.
Keep active, right? That's what the step count's showing you.
And Malcolm, I think you now need to rush off to carry out some heart surgery. Is that right?
Yeah, I think that's probably time, right?
So that is definitely a Zoe first. We've had a few people had to deliver babies, but heart surgery, This is brand new. Thank you so much for taking the time. I think we had better wrap up. That sounds pretty important. I really enjoyed it. Thank you so much.
Thank you so much for having me. That's been great.
If you enjoyed today's episode, I know you'll enjoy watching this conversation with Dr. Peter Atrial, a world-renowned expert in longevity medicine. The episode explores science-backed ways to help you feel better and live longer.